So JJ McCarthy, word just got announced that he had a second surgery. I'm not overly concerned about it, and we'll talk about why that is. So initially he had a tear of that meniscus, and instead of doing a clipping or what they call a meniscectomy, they opted to do meniscus repair. A meniscectomy is where they just clip out a piece of the torn meniscus, and a meniscus repair is, as you can see there, where they actually repair the torn meniscus and stitch it back together. You can see right there, that top left corner, that's the anatomy of a normal knee joint, and those C-shaped structures, those are the meniscus. In certain parts of the meniscus, they have what's called a red-red zone and a white-white zone, and that indicates the kind of blood flow that's in the area. So you can see right there, you have the red zone that's extremely close to blood vessels, and that prompts better healing. So when you see a tear that's in the red zone or the red-white zone, then typically you want to opt for a meniscus repair. But if it's in the white zone, then even if you repair it, then it can not heal back extremely well and still lead to scar tissue and still lead to rough edges and chronic pain. So in that situation, a lot of times they opt for just a clipping where they clip that meniscus out. These are different types of meniscus tears that you might see. So when you see a linear straight tear in that red zone or red-white zone, that's great for repairing it. But when you see these big irregular tears like a bucket handle tear or a radial tear that kind of goes across multiple zones, or you see an irregular flap tear, unless it's extremely well approximated, meaning it lines up perfectly with the tear edges, then people typically go with a meniscectomy. Occasionally with athletes, they can still go for the repair because repairs cause a less incidence of post-traumatic arthritis, although with any kind of surgery, there is an increased risk of arthritis. When you have a meniscectomy and you're clipping out a piece of the meniscus, you can guess that you have more bone-to-bone contact, and that prompts more friction and risk of early onset arthritis. So what is this surgery that JJ had, and is it going to affect his long-term prognosis? Basically, when they're still having swelling months after the repair with increased activity, then they go back in there arthroscopically. So you can see here, minimally invasive, and they just check to see if there's any kind of loose, frayed pieces of the meniscus going around, or maybe if that bone had some rough edges around it. They might have seen this initially, but a lot of times visual doesn't always lead to actual symptoms. So they do their spot repair and then they see how the symptoms progress. And in most cases, they do fine. In certain cases, like JJ, it seems like he had some swelling with the increased football activity. So they went in there, they did some cleaning up, meaning they smoothed the bone edges, they possibly removed some frayed fragments, but this doesn't really alter his long-term timeline that significantly. So I wouldn't be overly concerned about this. This is not something that's out of the ordinary, and he should be good to go by the start of next season. So I'm not really worried for JJ McCarthy based on this analysis and based on the reports that we're hearing.